Right-sided heart failure, RHF, or right ventricular failure, RVF, occurs when the right ventricle, RV, cannot effectively pump deoxygenated blood into the lungs. This inability results in a backup of blood into the systemic venous circulation, the body's veins, and a failure to adequately deliver blood to the left side of the heart. The mechanism of right heart failure is typically driven by three main factors, which lead to impaired contractility of the right ventricle. 1. Increased afterload, pressure overload, the most common mechanism. This occurs when there is increased resistance, pressure, that the right ventricle must pump against to push blood into the lungs. The most common source of this pressure increase is a problem on the left side of the heart. Left-sided heart failure, most common cause of RHF. Failure of the left ventricle, LV, causes blood and pressure to back up into the pulmonary circulation, the lungs. This leads to pulmonary hypertension, high blood pressure in the lungs, which significantly increases the resistance, afterload, that the right ventricle must overcome. Over time, the right ventricle, which is thin-walled and not built for high pressure, becomes overworked, thickens, hypertrophy, dilates, and eventually fails. Primary pulmonary conditions, cor pulmonale, diseases affecting the lungs can directly increase pulmonary vascular resistance. Examples include chronic obstructive pulmonary disease, COPD, pulmonary embolism, and pulmonary arterial hypertension, PAR. The RV compensates by increasing contractility, but eventually exhausts its reserves, leading to dilation and failure. 2. Increased preload, volume overload. This involves an excess volume of blood entering the right ventricle, which stretches the chamber and can lead to damage over time. Right-sided valvular regurgitation. Conditions like tricuspid or pulmonic valve insufficiency, leaky valves, cause blood to flow backward into the right ventricle, increasing the volume it must handle with each beat. Congenital shunts. Defects like an atrial septal defect, ASD, allow blood to shunt from the left side of the heart, high pressure, to the right side, low pressure, excessively increasing the volume load on the right ventricle.